Good afternoon, everyone, and thank you for being here. I certainly want to wish everybody a happy Lunar New Year to everyone celebrating today. Had several friends text me this morning on wishing me a happy Lunar New Year, so we right back at everybody out there that's celebrating that New Year celebration. So I'm joined here by a whole government COVID response team. I thought it was important, as this is the first press event that we've had since the transition is now in full swing, and I want people to know that it's in progress and that we've got very capable people in the state of Rhode Island that are leading the charge in terms of the transition at the Department of Health. Thank you for Lieutenant Governor Matos for being here, Interim Department Director of Health, Director Dr. Jim McDonald, Mark Pappas, Senior Advisor on COVID, General Callahan, Commerce Secretary Stephen Pryor, and Department of Health Transition Team we announced last week with Anna Novas, as along with Assistant Secretary of Health and Human Services, Ernie Almonte, Chief of Staff for the Lieutenant Governor, and Chris Aberline, who is Deputy Chief of Staff in the Governor's Office. Earlier today, I visited the Department of Health and got your feet on the ground and went from department to department with the direction of Dr. McDonald, met people in the finance, met people who are working on issues that have to do with infants and moms, recent moms, and other areas that in technology, and saw firsthand and spoke to everyone that we could meet, and we'll come back again to finish it up. It's a large department that does a great deal of important work, and I want to thank them for the work not only during COVID, but also prior to COVID, and the work that continues to go on in the Department of Health that is related to COVID and actually not related to COVID. So in just a bit, before I turn it over to Dr. McDonald, I'm going to ask Anna and Ernie and Chris to just come up to the mic and briefly share their background and what they will be doing at the Department of Health as we inform the people in the state of Rhode Island about the transition that's going on right now. I want to begin by talking about what Rhode Island is currently seeing in terms of data trends. It is important to note, we know that our testing and case numbers from this weekend were impacted by the storm, as I said, tongue-in-cheek, the TB12 2022 blizzard, but it's very clear that we have seen a dramatic decrease this month, and week over week our numbers are moving in the right direction. If we look only at our pre-snow storm numbers, cases are down roughly 75% since Rhode Island experienced its spike in cases in early January, and that's good news for us. I want to thank Rhode Islanders for stepping up and doing the right thing, getting vaccinated, getting boosted, and following our mask and vaccine protocols. We are starting to see the light at the end of the tunnel when it comes to this winter surge, so let's keep it going. Our 7-day case average is declining, just as it was last week. It's down 47% from a week ago. Our 7-day average for percent positive is also down from 18.5% last week to 15.6% this week. Yesterday we were at about 12.5%. Our hospitalizations have also dropped below 400 for the last 7 days. The data is continuing to show that Rhode Island is moving in the right direction. On FEMA and Ring hospital staffing, I have an update on our administration's plan to address the staffing crisis that continues to impact our local hospitals and their systems. I'm announcing today that we're expanding our use of the National Guard to support several hospitals across the state, in addition to the Butler Hospital mission. Our total of 30 National Guard members are being sent to the following hospitals: Eleanor Slater Hospital, Fatima, Kent, Landmark, Miriam, Newport, Rhode Island Hospital, Roger Williams Medical Center, South County Hospital, and Women's and Infants. I can't thank the General Callahan enough for him and his National Guard members for that work and stepping up again and again and again to do what we need to keep the people safe in the state of Rhode Island. This morning I visited Rhode Island Hospital to meet and thank the federal medical military personnel that we secured through FEMA. From what we've seen, the partnership is working well, and hospitals are grateful for the relief, and leadership at the hospital, which I spoke to, felt as though that this is making a significant impact in a positive way. And so we thank FEMA and all those individuals that came from states around the country. When I was talking to the individuals that came here to help Rhode Island, you had people from Hawaii, Minnesota, Texas, you had people from New Jersey, all around the country that are serving this country. And actually they promoted a major today, right, General? A major was promoted, and they zoomed their family in from Texas so that they could participate in that, moving someone to a major. And that was a great swearing in that we were able to attend. So we're currently in process of requesting a 30-day extension for the federal medical personnel team at the Rhode Island Hospital. The Kent Hospital team, which was on a 2-week assignment, has been approved for a 2-week extension, and we are preparing to ask for another extension on top of that. So we thank FEMA and the administrator, who I did talk to last week during the storm, and thanked her for advancing personnel to the state of Rhode Island in a way that's helping us significantly deal with the staffing issues at our hospitals. We're also taking another step to address staffing levels. I signed an executive order that eases requirements and allows nurse graduates to practice sooner under the supervision of licensed RNs while their regular license applications are processed. Our team is currently continuing to work on this issue and identify new ways to provide relief. Nothing is going to provide relief to our hospitals than a reduction of hospitalizations. So that's why we're encouraging people to get boosted, continue to work on that, and to protect themselves in a way that keeps their families safe. And again, nothing is going to provide more relief in the hospitals than keeping people out of the hospital. Before I turn it over, I want to remind our small businesses out there that we have a new Rhode Island Rebound Small Business Grant Program. Opens today at 3:30. Thank you, Secretary Pryor, and your staff for being so quick to get this on the ground. Applications will be accepted through February 15th, 2022. Through this program, we're making $12.5 million in direct relief grants available to small businesses that continue to struggle financially due to the COVID-19 pandemic. I want to thank our leaders in the General Assembly, Speaker Sakachi, along with President Ruggiero, for passing our proposal earlier this month to allow a much-needed investment in our state's small businesses early in the new year. Part of those dollars has to do with housing as well as child care, and we'll be updating the people of Rhode Island on how those dollars will be distributed very soon. In one of my first acts as governor, we set up a Rhode Island Relief Grant Program, which deployed checks and assisted about 3,600 small businesses. We know small businesses are struggling, and this is an additional strategy for businesses to get some help. Commerce Secretary Pryor and his team have been working to keep this as simple as possible. The federal government has certain requirements, and there is no wiggle room on some of it. But for our part, the state has tried to make this as simple and straightforward and as efficient as possible, and we stand prepared to help small businesses to work through the applications. This is a part of our plan to help small businesses. There are additional Rhode Island Rebound components that will be rolled out in the coming weeks and months, including technical assistance, funds for outdoor activities, improving ventilation, and additional for our hard-working, hard-hit tourism, hospitality, and event industries. Secretary Pryor is here today, and should there be any questions about this grant program, he stands ready to answer that. So with that, I'd like to call Ernie and Anna and Chris up. I'd like to just have them spend like 30 seconds, 45 seconds introducing and describing the role that they're going to play at the Department of Health over the next several months to make sure that our transition is strong and it keeps people in the state of Rhode Island safe. So Ernie, why don't you come up first, and then Anna, then Chris, share with it, and then turn it over to Dr. McDonald. Thank you.
Thank you, Governor. And I also want to thank Lieutenant Governor Sabino Matos, who exercised leadership in allowing me to be lent over to the Department of Health. I thank you very much, Lieutenant Governor. My name is Ernie Almonte. I'm a CPA. I'm the former Auditor General for 17 years, where I was responsible to audit all federal, state, and local government. I'm a CPA. I have a deep understanding of finances, federal, state, and local government regulations, and federal, state, and local government finances. So I'd like to introduce Anna Novesh.
Thank you, Ernie, and good afternoon, everyone. My name is Anna Novesh. I would like to start by thanking both Governor McKee and Secretary Jones for asking me to step in and support, which I gladly do. I am a psychologist by education. I bring 35 years, I think I counted by my daughter's age, of public health experience, worked in Africa, worked in Europe, and for the past 20-something years, I've been working in public health at the Department of Health since 1998, and for the past, since August 2020, as the Assistant Secretary at the OHHS. So glad to step back into a role that I've done supporting day-to-day operations across the department with the COVID response and really supporting the leadership and the transition at the health department. So thank you, and thank you. Chris, Pastor Chris.
Thank you, Anna, and good afternoon, everybody. First of all, I'd like to thank Governor McKee for his leadership in this space. And I am Chris Abulime. I'm Deputy Chief for Governor McKee, and I've done this since March when he became governor, and I've enjoyed doing this. But recently, he has asked me to provide operational support for the transition team that's in Rideau at this time because of his laser focus on the success of the department. So I'm going to be there for the time that I'm needed and to provide this support and ensure that there is solid communication between the department and the governor's office to respond to the needs of the transition team and the needs of the department. And beside that, I'm also coordinating the search for a new director of Rideau. So between the search for a new director of Rideau and supporting transition team, I'm very confident that we will have a path forward and a successful transition and also onboarding a new director of health. So once again, thank you, Governor, for your leadership in this space. And like you heard earlier on, the Governor was on site today at Rideau and walked through the different department that he was able to see. And that is his commitment to the department, commitment to every single citizen of this state to ensure that the wellness and health and safety of every Rhode Islander is a high priority, as it should be for the governor. So once again, thank you.
Hi, everybody. It's good to be with you again today. I do want to thank the governor for coming over to Department of Health. You know, I can't recall ever a sitting governor just coming over, walking throughout the cubicles and just saying hello to folks, and it was well received. I think, you know, one of the things that's just nice about the pandemic at this point is just actually seeing people in person. And one of the things I really enjoyed about our visit was just me sitting down with the division directors, which is the thing, we haven't done that in 2 years, so it was just fun to just chat with people and just have the governor there as well. And Governor Matos, it's good to see you as well again today. You know, one of the things I just want to chat a little bit about today is just the word treatment. And I just think it's important to keep the word treatment top of mind. You know, we do have treatment available in Rhode Island. You know, you've heard about monoclonal antibodies for quite some time. The oral antivirals are relatively new, though. You know, these are not common household words, like Paxlovid, which is actually 2 drugs. When you go to the pharmacy, they're going to give you a course of treatment, but it's actually 2 different medicines you take. And then there's another one from Merck called Molnupiravir, which is, you know, that just doesn't roll off anyone's tongue. My point, though, is that we actually have oral antivirals in the state, and we still have a decent supply of them. There's this national shortage, but what we've prioritized for the people who get the oral antivirals and the monoclonal antibody that still works, the sotrovimab, is people who are 65 or older, or people who are younger with other significant comorbidities. So we do have treatment available. And one of the things I just want to give you a little bit of background on is that when we learned the oral antivirals were coming around on December 29th, we actually had Professor Dr. Milanakis, the head of infectious diseases and lifespan, actually give a talk to all the providers in the state during one of our calls. So for an hour, he went through the pharmacology, how the drug works. So we've done other CME events too. And what we've done is really try to make sure your healthcare provider understands how the oral antiviral medicines work and, where to access them. I mean, one of the things that we had, a vision of is like, look, these are new drugs. In order for doctors and other healthcare providers to feel comfortable prescribing them we felt like someone should explain that. And, with these drugs being available through an emergency use authorization, it really fell to the Department of Health to do that. So we've done that. So your doctor should know these drugs exist and who they're for. And right now it's for people who are high risk, either 65 or older, or people who are younger with significant comorbidities. I think one of the things we have to put in the back of mind, though, and I think it's just something to think about, is like if you think back to the beginning of the pandemic, in the very beginning we talked a lot about restrictions. It was a very dark time in many ways, but it was really until we were ready to prevent the disease and treat the disease. And we're at a point now where we almost are there, right? In other words, we've got really good vaccines that work. I really remind people I need you to get up to date. So if you hadn't got that third dose, I need you to do that. But we do have a significant amount of treatment available. So really it has become a preventable, treatable disease. Now, the national shortage of treatment, I think, is going to abate in the coming months. The Paxlovid I talked about that Pfizer manufactured, it's a great resource to have. I think it's, oral. It's like other pills we're used to taking. The molnupiravir, again, oral. These are things that start making it look like a normal everyday disease. So, to that degree, we're heading in the right direction. We still have, a little under 400 people in the hospital. So, again, like the governor said, the numbers are dropping. We're heading in a really good direction. And with that, I just want to close this one concept is that, we don't, severe COVID, if you get that up-to-date vaccine, much better chance of not having severe COVID. We just interviewed Dr. Mitchell Levy for our podcast, Public Health Out Loud. Dr. Chan and I just interviewed him. And one of the things he just talked about was, the people he sees in the intensive care units, over 90% of them are unvaccinated. And it's so avoidable at this point. And, I think it's just at this point, it's like with Moderna getting the full FDA approval for their vaccine, I think it's one less barrier that people need to think about. And so just encourage people to talk to your healthcare provider, see what makes sense for you. But I really encourage people to say, I've got to get up to date with that vaccine. With that positive note, let me turn it back to Governor McKee for questions.
Thank you, Doctor. We're going to start back with Jennifer. Thank you. Governor McKee, I just want to be clear. I know you talked about the expanding of National Guard troops, but will the FEMA help at Rhode Island Hospital, will that be expanding past the 30 days as well?
We're going to make that request.
Okay. Any update as to where we are with that request? Is it likely going to happen?
I think we've had good cooperation there. We had an extension I think we announced late last week, and I went back to it, a 2-week extension at Kent Hospital. So we're going to make that request, and we've had good people that have been working, including Director Pappas, making that request. So I'm not sure. Is there any other update on that at all, Mark? Or? Request is going in next week, sir. Okay, thank you. Request is going in next week in terms of extending the FEMA workers at the hospitals.
Wayne?
So I would like a little more detail, if we can have it, please, on what the Guard is doing, the numbers of people and the hospitals they're going to. If I heard correctly, it's about every hospital in the state, and I believe I also heard 30 people. So, General, maybe you can just give a little more detail. Thank you.
Yeah, no, thanks for the question, and good afternoon, everyone. Chris Callahan, I serve as your Adjutant General. So just a quick overview of where we are. Right now, we have 75 Rhode Island National Guard folks that are supporting 11 different hospitals. 45 are at Butler, and then the 30, as the governor mentioned, over the other 10. Their duties include patient monitoring, screening, ER waiting room, attendant, some in-hospital patient transportation, what we would call in layman's terms the wraparound services that allow for the higher end healthcare providers to do their work and not have to be managing some of the administrative tasks. So that's kind of what our role has been thus far.
Okay, sorry. This is for the governor or Dr. McDonald. Just with high school playoffs for sports right around the corner, has there been any discussion about maybe curbing the mask mandate where athletes might not have to wear them during actual competition?
Yeah, so we're discussing that, and we think that we'll have some information by next week, but that's a discussion point right now.
Governor McKee, this is for you. You mentioned that you went to the Department of Health today. You're supporting that department. Is this the first time that you went over to actually see the offices, and why the delay?
Well, so we've been in the department before, but not since the transition. So today was an important visit with, as the doctor said, Dr. McDonald said, with directors, meeting with them, and clearly the more that we can understand how the function of the department, both on COVID-related issues and non-COVID-related issues, as you can see, is a priority with us right now.
And secondly, the bill before the General Assembly that's sponsored by House Democrats, that would extend your COVID emergency powers until April. Is that something you support? Do you want to see that passed?
Yeah, so we sent a letter to House and Senate leadership a week ago or so, asking them what they would plan to do. We outlined all the executive orders that would be impacted, included some that, in terms of virtual meetings and others. We agree with their response to ask for a 60-day extension as an answer to that letter that we sent in terms of outlining what was in front of us if there wasn't an extension.
Governor, why the National Guard troops now as opposed to weeks ago? What's changed? I think we've been asking you about that for weeks, if not more than that, about what the holdup was in terms of moving National Guard troops into hospitals. Why now?
Well, I think that it's, I really, other than the fact that we certainly was open to that weeks ago, we're doing it now, and as I said, we're in a good place right now. We're finishing off the work, but if the general wants to weigh in on that, that'd be great.
Sorry. Just as a quick follow-on to pull the thread, as the governor mentioned, excellent question. And one of the things that we wanted to bring forth as an organization, and part of the theory behind the smaller numbers at these 10 other hospitals, is essentially to lay groundwork, to lay the liaison sort of relationships to get a feel for what the hospitals may or may not need. So specific to your question, Brian, there was on the table, the specific issue was a need within the healthcare system here of healthcare providers, specific healthcare providers. And I think what I shared with the group last week in our earlier press conference was, from a National Guard perspective, what that would have meant is taking our healthcare providers out of their civilian roles and then bringing them into potential other, the hospitals and other healthcare providing facilities. And so what we would be doing, literally is creating another vacuum. So that's why the National Guard sort of approach was more focused on wraparound services, and that just took, a couple more weeks to develop.
Governor, if I could just follow up. I know, Reverend Aboulamé mentioned that one of his roles in the Department of Health is going to make sure there's good communication between the department and your office. Are you acknowledging that perhaps there was not good communication between your office and Dr. Alexander Scott in terms of what was happening over the last few months?
No, what I'm acknowledging is there's a transition, and transitions are very important, and we're putting resources into making sure that transition happens in a way that protects the people in the state of Rhode Island. And I think that it makes sense to, set it up the way we have. We're here today to kind of describe what that looks like to the people in the state so that they have confidence that it's been handled in a good way. Transitions can, can be disruptive, or they can be very positive. And so we're making every move we can, and we're showing that today, that the transition is going very smoothly, and the people of the state of Rhode Island will benefit from this transition.
Governor, I'd like to just continue the conversation about tonight's Senate and House hearings. Governor, citizens enact Constitution specifically to protect the citizenry against the governmental abuse of powers not formally accorded to the state, and to maintain a series of checks and balances between the executive, legislative, and judicial branches. In Rhode Island, while the Constitution is silent on the use of executive orders, poorly worded statutes have allowed the state of Rhode Island to be ruled under unchecked executive powers for nearly 2 years. The non-delegation doctrine under separation of powers requires that there be sufficient safeguards against administrative abuse of said delegated powers. Example, the Rhode Island Department of Health continues the use of arbitrary, ever-changing regulations and acting as an unelected yet weaponized body of government. My question, why would Rhode Islanders and citizens continue to support Rhode Island government when your administration, in conjunction with the General Assembly that has clearly abdicated its duty as legislative oversight in the executive branch, has simply chosen to ignore the civil liberties of thousands of Rhode Islanders who have said enough, it's time to learn to live with COVID and not have either COVID or government control their lives?
Well, thanks for the question. That's kind of a good one to be able to answer. The people of Rhode Island are going to follow the lead because of the way that we've conducted our affairs, at least since I've been governor, going from virtually last in vaccination rates to the top in the country, in terms of infection rates, doing the same thing, going from one of the most infected states to one of the least infected states in the country. I think I looked at today, I think we're the 42nd least infected state in the country on infections. So they're going to have confidence in the performance, and there hasn't been an overreach, at least by the time that I've been governor. We're doing what makes sense, and we're not doing, I think the list of executive orders have been reduced by almost 65%. So we're doing what is necessary, and as I said earlier, question from Anita, the fact is the matter that we laid out to the General Assembly in letter form what could be happening if there wasn't an extension. We didn't ask for an extension. We let everybody know that these are the parameters that are going to be impacted, and as a result, the compromise that is being presented, we're supporting that in a 60-day extension. And we're not abusing any rights. We're protecting the people in the state of Rhode Island.
For Dr. McDonald, actually. I won't rehash the governor's quite accurate recounting of our numbers, which were dead on. We've had a 75% reduction over the last couple of weeks in cases. But first, do you believe that's an accurate reflection of the real situation, or to what extent is it instead driven by a migration from testing centers like PCR tests to at-home tests with rapid antigen kits? Because most people probably who are testing positive or even negative with rapid antigen tests are not reporting their results, although I do realize there's a state website to allow them to do it. And secondly, the WHO's briefing this morning, World Health Organization's briefing this morning, noted that although cases have been dropping over the last few weeks, just as they are in Rhode Island, they're doing that in the rest of the world, that they're seeing deaths increasing. Now, to some extent, of course, that's because deaths are a lagging indicator following caseload. But what do you expect to see in Rhode Island in terms of cases and deaths over the next, say, 2 to 4 weeks or even 8 weeks, if you have some insight on that?
So that's a lot of question. Yes, at-home tests are definitely happening, right? And you're going to get at-home tests that are positive or negative, and right, people can report but probably aren't reporting. I know that. So you're going to see cases drop in many ways regardless. So that case dropping, it's still a number I'm looking at, but I'm more interested in the hospitalization numbers because that I have a great deal of visibility on. And so, and that number is really important. I think as far as deaths go, it is a lagging indicator, and we're going to still see that, but that's going to wane off as well. You're asking what I see in 2 weeks, 4 weeks, and 8 weeks. So, it's funny. The groundhog is going to do some prognostication tomorrow, and maybe I'll be better than the groundhog, right? But with the disclaimer that here's what I see happening. Yeah, our case counts are going to drop. Our hospitalization counts are going to drop. I think in the next, 4 to 6 weeks, you're really going to see a substantial drop in hospitalizations. The deaths will follow as well. I think it sets us up for maybe a false sense of security, though. Because one of the things I think we really need to be careful about is, it's funny. The pandemic has been a very personal injury to everybody. And you all in this room have your own personal injury from pandemic and your own story from it. But I think we have to keep in mind that there's a global story. And the far, far majority of the globe doesn't have anywhere near the vaccine quality we have or the vaccine quantity we have. So we are a planet that's still very much at risk of new variants, and we're a planet that's very subject to a lot of morbidity and mortality. What I worry about is a rising variant. Obviously, we, like every other health department in the United States, is looking for another variant. We keep track of these things. Everybody else is doing sequencing. Having said that, better the enemy you know than having your head in the sand, right? Because here's something I know about 2 years ago. 2 years ago, we weren't testing everybody and their brother for a virus. 2 years ago, nobody was sequencing genomes like right and left. And, you know, in that way, I think like to some degree, it's like one of the things I talked about today with some of the Department of Health staff is like as people are processing their own personal trauma from the pandemic, I've been just celebrating myself with Anna and others at the Department of Health, some of my, you know, positive, impactful memories. Like I've seen really positive things that have come out of this pandemic, not the least which is, you know, it's been fun to see working with other state agencies, but I think it's been kind of cool is like, look, science just took Star Trek medicine like it was no one's business, right? We are now doing genomic sequencing all the time. You know, we're seeing monoclonal antibodies, new ones being developed for Omicron. We have really good vaccines. We have oral antivirals. There's a reason why there wasn't an invention of a pill for a common cold years ago. But quite frankly, now we're seeing really targeted therapies that work. So, you know, part of what I want to just say is, yeah, there's a little bit of unpredictability to the future. But I am optimistic about where science has brought us and where it's going to bring us. And, you know, I just invite people to just think about that in particular. It's like, wow. Look at where we have come as a species in the last 2 years, because science has really brought us very, very far. And I think that's a very positive note to end on from me on this question, because you get a long question, so you get a really long answer, my friend.
Right over here. Yes, either for Dr. McDonald or Anna Novice. Does the health department currently have enough resources and staff to do the job that it needs to do, or does it need more staff, more money? And second to that is, do we know how much money was spent on consultants such as the Boston Consulting Group? How many millions of dollars was spent on them? And might that have been better directed in investment in health department staff?
So, Richard, let me just answer that directly. So, as far as does the Department of Health have enough staff right now? Yes, we have enough staff right now. I like the quality of person I have, and I enjoy the quantity of person I have. One of the things, though, I'm trying to get the Department of Health to do, and I'll just say this, like one of the things that I think people just need to understand is that one of the concepts I talked last week is, you know, becoming interim director, I said to people, it's like, guys, 5 o'clock needs to mean something now. Saturday and Sunday need to mean something now, too. What it needs to mean is we're done working. And if we're going to contact each other after hours, which we just quite frankly gotten used to over the last 2 years, it really has to be a compelling reason. So one of the things I'm trying to get the staff to do is actually work reasonable hours. But I really want to say that, Richard, it's like, you know, this is the quality of person I have at the Department of Health. In other words, they're just so committed and dedicated. You know, I was just talking to someone today, you know, one of our leaders, and just from how I love this work. But we have to find a way to dial that back for people. You asked about Boston Consulting Group. I actually don't know how much money we spent on Boston Consulting Group because I've only recently gotten access to the checkbook, and I promise I'll spend the taxpayer dollars extremely wisely, just so you know, because I pay taxes too. By the way, I started doing my taxes last night. I'm not happy, but we're going to do what we need to do April 15th, all right? But my point is this, is that I actually thought Boston Consulting Group was extremely helpful to me. You know, they were great at the beginning. They brought us a lot of infrastructure. They were very helpful to the team at the time because, quite frankly, we were really building so much so quickly. I thought they were great. I understand they left, and we've had other consultants. You know, they've been helpful too. But, like, it's not the consultants who are running the response. It's the Department of Health people. Those are the people that I work with and I've known for the last decade. And by the way, February 26th, I celebrate 10 years at the Department of Health. It turns out there's no prize for that, but I just thought you'd want to know. And my point being is, though, it's fun to work with these great people. It really is. And so I guess I'm just saying is I feel like the Department of Health is very healthy right now. It's stable. You know, it was kind of fun to walk around with people, though. But, you know, there's just not a lot of people complaining about things. It doesn't mean they're not working hard. They are. But they're just a good group of people. I hope that answers it enough. I'm doing the best I can.
Thank you. We have time for one more. Doctor, don't go far. Doctor, don't go far. The governor opened up saying that we've seen a very dramatic decrease in the numbers, are moving in the right direction, starting to see the light at the end of the tunnel. In response to Michael's question, you seem to put a pin into much of that. I was going to ask, can we expect to see any changes as a result of seeing light at the end of the tunnel, but you seem to be saying no.
Oh, I think there's definitely a light at the end of the tunnel. And I think it's just hard to, what I don't want to commit to is just being a little humble before the power of the pandemic, my friends. In other words, the thing, it's funny, my wife tells me the whole time, just to stop telling me when you think it's going to end, because there's always another wave, right? So that's just me being humble. But it's like when you look at Omicron's wave, I think it's going to, I think we're going to see this subside in the coming weeks. I think what we really see there was like, I don't think people should leave here thinking the pandemic itself is going to end. It's going to become an endemic disease, right? Like, we're not looking at a smallpox eradicated virus situation. We're looking at a disease we're going to learn to live with. And until we get the planet vaccinated, we're just not there. And what I was trying to answer Mike with was just sort of kind of anticipating and maybe just sort of acknowledging the globality of his question, quite frankly, is that this is a global issue. And quite frankly, when you look at how we are just so blessed with really powerful, great vaccines and treatments, the rest of the world isn't there by even a long shot. And part of what I'm just saying is we are really in this global community. And if there's another variant, we're dealing with this as well. So part of what I'm saying is I'm definitely optimistic about our future. I like where we're headed. And I feel like part of my role as interim director is kind of, I used to joke around the department. We were building the plane while we're flying in the beginning. And at some point I'd say, well, yeah, stop doing this, guys. We can stop building the plane. Let's just fly the plane. But I think we're going to land the plane in the coming, weeks to month or so. I think it's time to land this plane. And then we'll just see where it brings us. Now, I can't promise we're not taking off again. That's the whole variant thing, all right? And so I'm answering it as honestly as I can in the situation we're in. Thank you, everybody.
Ray, actually, and then we're going to wrap it up. Go ahead, Ray.
Okay, Governor, you're looking for a new director for the Department of Health. It's only going to be there for 10 months. What is guarantee that we're going to get a good quality candidate to take the job? Why you don't let Dr. McDonald finish the whole year there? Looking for somebody from the outside that we don't know if we're going to get a good candidate, or you have a good offer to make to the new director?
Yeah, so first, we're very happy that, Dr. McDonald has agreed to take the role he's taken right now, and he knows he's been here since day one on the pandemic, and he also years before that, so he understands the department well. So we're very pleased there. We will continue to do as Chris mentioned earlier, we will continue to do a search, and we'll be working with the Senate and others in terms of how we're progressing on that. So we need to keep on working and do the work that we're going to do. A new director, when they put in place, they have a constitutional term that will be in that 5-year time frame. So we'll be careful about it. And Dr. McDonald has given us the breathing room to make sure that we are vetting several candidates in a way that will make sense as if we do come out with a candidate prior to the end of the year.
Governor, do you expect to end the mask mandate before it expires, or what are you looking at there?
Yeah, so I think everything is open right now in terms of the discussion. We was asked earlier about the masking in terms of the athletes. We're looking at what other states are doing. I was in conversation with bordering governors yesterday about these very issues. So everything's under consideration, but we're going to do what's the best for the people in the state of Rhode Island in terms of their health.